Stop everything you are doing right now and look at your hands. Look at them carefully. Are your knuckles swollen, visibly larger than they used to be, with that characteristic knobby, inflamed appearance that has been developing over months or years? Are your fingers stiff when you wake up in the morning, requiring 15, 30, sometimes 60 minutes of painful warming up before you can use them for the simplest tasks? Can you button your shirt without stopping? Can you open a jar without asking for help? Can you hold a pen or a pencil for more than a few minutes without the aching becoming distracting enough to interrupt your concentration? These are not trivial inconveniences. The loss of hand function, the progressive daily theft of the fine motor capacity that allows you to dress yourself, prepare your own food, pursue the hobbies and crafts and activities that have given your hands purpose for decades, is one of the most personally devastating consequences of joint disease in adults over 70. It is intimate in a way that knee pain or hip pain is not. Your hands are how you interact with the world. When they stop working, you stop being able to do the things that make you yourself. And here is what you need to know. The cartilage in your finger joints, the small, intricate cartilage surfaces of the proximal and distal interphalangeal joints, the metacarpophalangeal joints, the carpometacarpal joints at the base of your thumb, is not simply worn away by age. It is being actively degraded by a specific inflammatory process that has specific, addressable biochemical causes. And a drink. One drink, made from 3 compounds in warm water, costing less than 70 cents per day, can interrupt that degradation process and begin restoring the cartilage environment that your finger joints have been losing. Carol is 71 years old. She has been playing piano since she was 7. 64 years of music, concerts, recitals, church services, afternoons at her instrument that she describes as the most consistently meaningful hours of her life. 3 years ago, the arthritis in her hands progressed to the point where playing piano had become impossible. The stiffness, the swelling, the pain of pressing keys. Her music stopped. She drank this every morning for 21 days. On day 19, Carol sat down at her piano. She played for 40 minutes. She came to her follow-up appointment with me and said, "I played for 40 minutes, and I cried the entire time, not from pain, from the music coming back." Let me show you exactly what Carol was drinking, and why it worked when 3 years of medical management could not give her music back. Carol came to me 9 months ago, referred by her occupational therapist who had been working with her on adaptive strategies for hand function and had reached the point where she felt Carol deserved more than adaptive strategies. She deserved her hands back. Carol was 71. She had been diagnosed with osteoarthritis of both hands at 67, presenting first in the distal interphalangeal joints, the last knuckle of each finger, and progressing over 4 years to involve the proximal interphalangeal joints and the base of the thumb on both sides. She had what her rheumatologist described as moderately severe bilateral hand osteoarthritis, not the most severe presentation, but significant enough to substantially limit function. She had tried glucosamine and chondroitin for 18 months, the most commonly recommended over-the-counter joint supplement combination, without meaningful improvement. She had used paraffin wax baths, which provided temporary warmth-related relief lasting an hour or 2 after each session. She had worn compression gloves at night as recommended by her occupational therapist. They helped with morning stiffness duration, but had not changed the underlying progression. Her rheumatologist had offered cortisone injections into the most symptomatic joints, the thumb-based joints specifically, which were limiting her ability to grip and pinch. She had declined, having read about the cumulative cartilage damage from repeated steroid injections. The piano had been the last thing to go. For 2 years after the arthritis began, she had adapted, shorter practice sessions, adjusted technique, particular attention to warming up before playing. But by 3 years in, the combination of morning stiffness that lasted past noon on bad days, the pain of the key pressure during playing, and the progressive loss of the fine motor control that intricate musical passages require, had made playing genuinely impossible. Not difficult. Impossible. She sat across from me and said one sentence that I have thought about often since. She said, "I have played piano for 64 years, and I want to die having played piano." That is not dramatic. That is just what I want. I told her about the drink. I explained the mechanism. I gave her the protocol and the timing. I told her to give it 21 days before judging whether it was working. On day 19, she sat at her piano for the first time in 8 months. She played scales first, then a piece she had known for 40 years, a Chopin nocturne that her teacher had given her when she was 16. She played for 40 minutes. She told me about it at her follow-up appointment with tears still visible on her face. She said, "I thought that part of my life was over. I thought I was done with music. I was wrong." Understanding why finger joint cartilage fails differently from knee or hip cartilage, and why this difference makes the morning drink particularly effective for the hands, requires understanding the unique anatomy and biomechanics of the small joints of the hand. The finger joints, the proximal and distal interphalangeal joints, the metacarpophalangeal joints, are among the smallest synovial joints in the body. They are hinge joints, designed for the precise, fine-grained motion that makes human hands capable of tasks no other species can perform. They are not weight-bearing joints. They do not carry the body's mass the way knees and hips do, but they experience enormous repetitive loading from the gripping, pinching, typing, writing, turning, and lifting that hands perform hundreds of times per day. The cartilage surfaces of finger joints are thinner than knee or hip cartilage, typically 0.5 to 2 millimeters, compared to 2 to 4 millimeters in the knee. This thinness means that even small amounts of cartilage loss produce proportionally greater functional consequences. A 1 millimeter loss of cartilage in the knee is significant, but leaves substantial cushioning remaining. A 1 millimeter loss in a finger joint that began with 1.5 millimeters represents 2/3 of the joint's entire cartilage thickness. The synovial environment of small finger joints is also proportionally more concentrated than in large joints. The same inflammatory cytokines, IL-1 beta, TNF-alpha, matrix metalloproteinases, that are present in any arthritic joint are present in smaller absolute volumes in finger joints, but at similar or higher concentrations. The concentrated inflammatory environment produces proportionally aggressive cartilage degradation, which is why finger joint arthritis can progress rapidly and produce visible structural changes. The Heberden's nodes at distal joints, the Bouchard's nodes at proximal joints, relatively quickly. The morning stiffness of finger arthritis has a specific mechanism that is worth understanding because it explains both why the stiffness occurs and how the drink addresses it. During sleep, the hands rest in a partially closed position, often curled against the body. In this resting position, synovial fluid circulation in the small joints essentially ceases. Inflammatory cytokines and matrix metalloproteinases that are continuously produced by the inflamed synovial membrane accumulate in the joint space without being cleared by movement. When you wake up and begin to move your fingers, this accumulated inflammatory fluid must be redistributed and partially cleared by the mechanical action of joint movement before the cartilage surfaces can interact with normal lubricating synovial fluid. The morning stiffness window, 15 to 60 minutes of painful, limited mobility, is the time required for this redistribution to occur. The drink addresses this specific mechanism at 2 levels. First, it reduces the production of the inflammatory cytokines that accumulate overnight, so the overnight accumulation is smaller and requires less time to redistribute at waking. Second, it provides the biochemical building blocks for restoring the normal protective components of synovial fluid, hyaluronic acid and lubricin, that have been partially displaced by the inflammatory fluid. Better synovial fluid quality means less friction, less pain, and faster morning clearance of the overnight inflammatory accumulation. The drink contains 3 ingredients, each targeting a different aspect of finger joint cartilage degradation and synovial inflammation. Each has peer-reviewed clinical research supporting its use, and the combination produces results that none of the 3 produces independently. Ingredient 1, silica-rich horsetail tea, 2 cups, approximately 500 milliliters, of tea brewed from Equisetum arvense, the common horsetail plant. Available dried from health food stores and herbal suppliers, brewed as a standard herbal tea. Horsetail contains the highest concentration of bioavailable silica of any plant, approximately 6 to 8% of the dried plant by weight. Silica, silicon dioxide in its bioavailable organic form, is a structural component of collagen crosslinks. The collagen fibers in cartilage are held together by crosslinks, molecular bridges that give cartilage its tensile strength and resistance to compression. These crosslinks depend on silicon as a cofactor for the enzyme prolyl hydroxylase, which is responsible for the hydroxylation of proline and lysine residues in collagen, the chemical modifications that allow collagen crosslinks to form. In silicon-deficient conditions, which are extremely common in modern diets that rely heavily on processed foods with reduced mineral content, collagen crosslink formation is impaired. The result is cartilage with structurally weaker collagen, more prone to degradation under the repetitive loading that finger joints experience. Silicon deficiency is one of the most consistently under-recognized contributors to progressive cartilage loss in hand arthritis. A study published in Archives of Gerontology and Geriatrics found that silicon supplementation significantly improved collagen synthesis markers and reduced inflammatory markers in adults with osteoarthritis compared to placebo. A separate study in the Journal of Nutrition, Health and Aging found that dietary silicon intake was inversely correlated with hand grip strength loss over 5 years in adults over 65, suggesting that silicon deficiency specifically affects the hand musculoskeletal system. Horsetail tea delivers approximately 50 to 60 milligrams of bioavailable silicon per cup, a therapeutic dose achievable through regular tea consumption at a cost of approximately 20 cents per day. Ingredient 2. Turmeric with black pepper. 1 teaspoon of turmeric powder and 1/4 teaspoon of black pepper powder dissolved in the hot horsetail tea. Curcumin, the active polyphenol in turmeric, is one of the most extensively researched natural anti-inflammatory compounds in existence. Its mechanism of action in joint tissue involves inhibition of NF-κB, the master inflammatory transcription factor, in both synoviocytes and chondrocytes, reducing the production of IL-1 beta, TNF-alpha, and the matrix metalloproteinases that degrade finger joint cartilage. It also inhibits KIOX2, the same enzyme that prescription anti-inflammatory drugs target, through a different binding mechanism that does not suppress the chondrocyte repair functions that pharmaceutical KIOX2 inhibitors also suppress. The challenge with curcumin is bioavailability. Curcumin consumed alone has very poor absorption from the gut. Approximately 1 to 2% of the ingested dose reaches systemic circulation. However, piperine, the active compound in black pepper, inhibits the intestinal enzyme CYP3A4 and the efflux transporter P-glycoprotein that are primarily responsible for curcumin metabolism and excretion in the gut wall. Adding black pepper increases curcumin bioavailability by up to 2,000%, from 1% to potentially 20% absorption. This is not a marginal improvement. It is the difference between a dose that produces measurable anti-inflammatory effects and one that does not. A meta-analysis published in the Journal of Medicinal Food, analyzing 8 randomized controlled trials, found that curcumin supplementation significantly reduced pain and improved physical function in patients with knee osteoarthritis. The effect was comparable to NSAIDs in several trials. A study in phytotherapy research specifically examining turmeric supplementation in hand osteoarthritis found significant reductions in morning stiffness duration and pain scores compared to placebo after 8 weeks. Ingredient 3. Collagen peptides with vitamin C. 10 grams of hydrolyzed collagen peptides dissolved in the hot tea, combined with 500 milligrams of vitamin C, either as a separate supplement or from a squeeze of fresh lemon juice added to the tea. For finger joint cartilage specifically, where the cartilage is thin and the degradation is proportionally severe, providing the building blocks for type 2 collagen synthesis is particularly critical. Hydrolyzed collagen peptides provide the specific amino acid ratios, glycine, proline, hydroxyproline, that the chondrocytes in finger joints need to synthesize new cartilage matrix. They are absorbed from the gut as dipeptides and tripeptides that are transported preferentially to collagen-rich tissues throughout the body. Vitamin C, ascorbic acid, is the essential cofactor for the enzyme prolyl hydroxylase, the same enzyme for which silicon is required. Without vitamin C, proline cannot be hydroxylated, collagen cannot be properly cross-linked, and the structural integrity of new collagen synthesis is compromised. Vitamin C deficiency, subclinical deficiency that does not produce scurvy but impairs optimal collagen synthesis, is common in adults over 70 who have limited fruit and vegetable intake. The combination of silicon from horsetail tea, providing the cross-link cofactor, with collagen peptides providing the structural building blocks, and vitamin C providing the hydroxylation cofactor produces a comprehensive support package for finger joint collagen synthesis. All 3 elements of the collagen production machinery are being supplied simultaneously. The synergy is not theoretical. It reflects the biochemical codependency of these 3 inputs in the collagen synthesis pathway. Here is exactly how Carol prepares this drink every morning and the specific details of timing and preparation that the research supports for maximizing efficacy. Carol wakes at 7 a.m. Her first action every morning, before anything else, is to put water on to boil. While the water heats, she prepares her mug. She adds 2 tablespoons of dried horsetail herb, available at health food stores in loose leaf or tea bag form, to a large tea infuser. She uses a 16-ounce mug to accommodate the full volume. She pours the just boiled water over the horsetail and allows it to steep for 10 minutes. Longer steeping extracts more silicon from the plant material. 10 minutes produces a significantly higher silicon content than the standard 3 to 5 minute tea steeping. She covers the mug while steeping to prevent evaporation of the volatile compounds that accompany the silicon extraction. After 10 minutes, she removes the infuser. While the tea is still hot, above approximately 80 degrees Celsius, she adds 1 teaspoon of turmeric powder and 1/4 teaspoon of black pepper. She stirs vigorously for 30 seconds. The turmeric does not fully dissolve. It remains in fine suspension. This is normal and expected. She stirs before each sip rather than relying on the powder remaining uniformly distributed. She then adds 10 grams of hydrolyzed collagen peptides, 1 full scoop from the container she keeps in the kitchen. Collagen peptides dissolve easily in hot liquid and are essentially tasteless. She stirs for 20 seconds. If she is using vitamin C powder, she adds 500 milligrams at this point. If she is using lemon, she squeezes half a lemon into the tea after it has cooled slightly below boiling temperature to preserve vitamin C, which is destroyed by boiling. Both methods are equally effective. She alternates based on what she has available. The final drink is a warm, golden orange-colored tea with a mildly spiced, pleasantly earthy flavor. The turmeric gives it its color and a subtle warmth. Carol describes it as the most genuinely pleasant of any therapeutic drink she has tried. She looks forward to it. She drinks the entire 16 ounces slowly over 10 to 15 minutes, standing at her kitchen window. While drinking, she performs the hand warm-up exercises her occupational therapist had recommended and that she had largely abandoned because they provided limited benefit without the accompanying biochemical support of the drink. The combination of the exercises and the drink, the mechanical loading of the finger joints during the window when the anti-inflammatory compounds are being absorbed, produces the synovial fluid distribution effect that either intervention alone does not achieve as effectively. The hand exercises she does are simple. She slowly opens each hand fully, spreading all fingers as wide as comfortable, then slowly closes into a gentle fist. 10 repetitions. Then she rotates each wrist in slow circles, 10 clockwise, 10 counterclockwise. Then she gently touches each fingertip to her thumb in sequence, index, middle, ring, little, back to index, 10 repetitions each hand. None of these exercises are forced or painful. They are performed within the comfortable range of motion available on that morning. After finishing the drink, she waits 20 minutes before eating breakfast. The collagen peptides require a relatively empty gut for optimal absorption. Food protein competes for the same absorption pathways. 20 minutes is sufficient. She uses the time for her shower and morning routine. One important practical note: horsetail tea should not be consumed without the accompanying vitamin C. Horsetail contains a thiaminase enzyme that, without vitamin C present, can theoretically degrade vitamin B1, thiamine, over time with very high consumption. The vitamin C in the protocol inhibits this enzyme. At the doses used in this protocol, 2 cups per day, this concern is minimal, but worth addressing by ensuring the vitamin C is included consistently. Carol kept meticulous records because she had been a music teacher for 30 years and had the organizational discipline that comes from decades of managing lesson plans and recital schedules. Her diary is one of the most detailed I have received from any patient. She established her baseline over 5 mornings before starting the protocol. Morning finger stiffness duration, averaging 58 minutes. Pain level on waking, 7 out of 10 across both hands. Grip strength. She measured this with a simple hand dynamometer I had lent her. Right hand 42 kilograms, left hand 38 kilograms. These were significantly below normal for her age and height, consistent with the cartilage and synovial damage in her joints. She noted, baseline established, starting tomorrow, days 1 through 4, stiffness duration averaging 55 minutes, pain rating 6 to 7, grip strength unchanged. Carol noted in her diary, nothing to report yet. I told her this was expected. The silicon from horsetail tea takes several days to accumulate to levels that affect collagen crosslink formation. The curcumin anti-inflammatory effect begins within the first 48 hours, but requires 4 to 5 days of consistent dosing to reach steady-state tissue concentrations. The collagen peptides are being absorbed, but have not yet provided enough building material for measurable cartilage synthesis. Continue. Day 5. Carol noted the first change. She wrote, "Morning routine different. Opened bathroom cabinet with right hand without thinking about it. Usually I have to use my left to pull the cabinet open with the right because the grip hurts. Today I just opened it. The grip was there." She rated pain at 5 out of 10. Stiffness, 50 minutes. Day 6. Pain, 4 out of 10. Stiffness, 43 minutes. Carol wrote, "The first 15 minutes this morning were almost normal. The joints were still stiff, but the aching was less sharp, less of the burning quality." The curcumin NF-κB inhibition in her synoviocytes had accumulated to therapeutically relevant levels by day 6. The inflammatory cytokine production in the joint was measurably reduced. The morning inflammatory fluid accumulation was beginning to be smaller and easier to redistribute. Day 8. Carol wrote, "Buttoned my shirt this morning. All buttons. First time in 8 months that I buttoned all of them myself in one go without stopping." She rated pain at 3 out of 10. She wrote in capital letters next to the 3. She underlined it twice. I understood why. Day 10. Grip strength measurement. Right hand 49 kilograms. Left hand 45 kilograms. Meaningful increase from baseline in 10 days. The collagen peptides and silicon were producing measurable structural changes in the tendon and cartilage tissue that supports grip strength. The joints were beginning to rebuild from the inside. Day 12. Carol wrote, held a pen for 40 minutes writing letters. Did not need to stop. Switched hands twice out of habit, not necessity. Had not written for 40 consecutive minutes in 3 years. Day 15. Pain rating 1 out of 10 upon waking. 1 from 7 at baseline. Morning stiffness 11 minutes from 58. Carol's diary entry for day 15 is the longest of any day in the protocol. She wrote about what it felt like to wake up and have hands that worked. She described going through her morning routine, opening things, touching things, using her hands for ordinary tasks, with a quality of attention she had not paid to those moments in years. When hands hurt, she wrote, you notice them constantly. When they don't hurt, you notice how much you missed not noticing them. Day 19. The piano. I have described this already. Carol did not write in her diary that evening. She wrote the entry the following morning. She wrote, played for 40 minutes last night. Chopin Nocturne in E-flat major, Op. 9 No. 2. First time in 8 months. The fingers found the keys like they remembered. I cried through all of it. My husband sat next to me on the bench. We didn't speak. There was nothing to say. Day 21. Pain 0 out of 10. No morning stiffness detectable. Grip strength, right hand 53 kilograms, left hand 49 kilograms. Above baseline in both hands. Carol wrote 21 days, 71 years old, playing piano, making breakfast, buttoning shirts. These are small things. They are everything. The sleeping hand position that is actively damaging your finger joint cartilage every night, and that compounds the inflammatory process this morning drink is working to reduce. This is something that Carol's occupational therapist had been recommending for 2 years, but that Carol had not consistently followed because she had not fully understood the mechanism. Once I explained why it mattered, she followed it without exception, and I believe it contributed meaningfully to her results. Most adults over 70 with hand arthritis sleep with their hands in a partially closed position, fingers partially flexed, often curled under the palm or against the chest. This partially flexed position is the hand's resting position of comfort, the position it defaults to when muscle activity is minimal. In a healthy hand, this is inconsequential. In arthritic finger joints, the partially flexed sleeping position places the proximal and distal interphalangeal joints in a position of capsular slack. The joint capsule, the connective tissue envelope surrounding each joint, is most lax in partial flexion. Lax joint capsules allow the inflamed synovial fluid to pool more freely in the joint space rather than being partially redistributed by capsular tension. The inflammatory cytokines and matrix metalloproteinases in this pooled fluid maintain contact with cartilage surfaces for longer overnight periods, accelerating cartilage degradation during the sleep window that should be the joint's recovery period. The solution: resting splints. Soft resting splints worn at night that hold the finger joints in a slightly extended neutral position rather than the natural flexed curl. These are not rigid splints. They are fabric and foam orthotic devices that gently maintain the hand in a position where the joint capsule has normal tension. The inflammatory fluid is less likely to pool at the cartilage surface, and the collagen synthesis that occurs during rest can proceed in a mechanically optimal environment. Resting splints are prescribed by occupational therapists and are available at medical supply stores. Carol had been given resting splints by her occupational therapist 2 years before she found the morning drink. She wore them inconsistently because they felt cumbersome and because she had not noticed dramatic benefit from them alone. When she combined consistent nightly splint wearing with the morning drink, the combination produced the morning stiffness reduction that accelerated dramatically from day 5 onward. She told me at her follow-up, "I never really wore the splints properly before. I thought they were a gimmick. Then I understood that they were stopping the inflammation from accumulating in my joints overnight, while the drink was reducing the inflammation during the day. Day and night, both covered. I should have been wearing them from the beginning." She was right. The protocol is most effective when the overnight inflammatory accumulation is mechanically minimized by the splints, and the daytime inflammatory production is biochemically reduced by the drink. Morning stiffness, which is the direct consequence of overnight inflammatory accumulation, responds most dramatically when both interventions are applied consistently. Carol played the Chopin Nocturne her teacher gave her when she was 16, 64 years after learning it, 40 minutes at the piano, crying through all of it, not from pain, from the music coming back. She is 71 years old. She has arthritis in both hands. She is playing piano. Not because her arthritis disappeared, the structural changes in her joints are still visible on imaging, but because the cartilage environment in her finger joints changed enough to restore function. The synovial fluid quality improved. The inflammatory accumulation reduced. The collagen synthesis resumed with the materials it had been missing. Her fingers found the keys again. Your hands are not finished. The cartilage in your finger joints is not beyond help. The inflammatory process driving its destruction has specific, addressable biochemical inputs that can be interrupted and redirected. Silicon, curcumin with black pepper, hydrolyzed collagen peptides with vitamin C, resting splints at night. Gentle morning hand mobilization during the absorption window. Try this for 21 days. Measure your morning stiffness duration from the day you start. Write it down each morning. Come back in 21 days with your progression. And leave a comment below right now. Tell me your age, which fingers give you the most trouble, and what activity you most want to be able to do again with your hands. I read every single comment. Everyone. Before I go, one request. Tell me your age and your #1 health challenge right now. I read every comment, everyone. Your comment might be exactly what someone else needs to see today. Subscribe. Tomorrow I have something just as important waiting for you. I will see you then.